Assalamualaikum and welcome to the step 1 of the Guide to Good Prescribing. So in this step, what you will learn is about how to define a patient's problem. It is very important for you to define the problem before you can go into step 2, 3, 4, 5 and also 6. So let's start. When a patient comes to see you, they usually come with a complaint or a set of complaints. So it depends on you on how to look at the complaints and from there to derive what is the problem with the patient. When a patient comes to you with a complaint or a problem, what you need to do is to ask more questions, including other histories, as well as do appropriate examination that is related, as well as order for some investigations that can help you to confirm your diagnosis or exclude some of your differential diagnoses. What more important is that always remember that not all the time that the patient comes to see you with a possible disease. Sometimes it could be things like trying to get a refill prescription, or the problem is not related to the complaint at all. It could be a simple cry of help. So it is very important for you to look at the both verbal cue as well as the non-verbal cue. Do you think these two cases, Mr. Lim and Mrs. Miller, have a similar diagnosis since both of them presented with headache? And with the given information, what potential diagnosis that has popped up in your mind? Now let's go and try and see the case individually and try to see what are their possible causes. Now let's look at these two cases. So let's go to case 1 first. Mr. Lim, do you think that you need more information on this case? If so, what are they? So you always need to ask for more questions about what his current presenting complaint about. You would like to know when visits start, what is the severity, and whether it's associated with other symptoms. You will also need to ask about his other past medical history that can predispose him to such problem. It's very important as well for us to find out about the social history, whether he is smoking or he takes alcohol. His medication history is also important because if you think about what he presented with, there is a possibility that he might have intracranial hemorrhage. Therefore, drugs that can lead to bleeding, such as warfarin or any antiplatelet agents, may predispose him to have intracranial hemorrhage. And what are the examination that you are going to do, and also the investigations that you're going to carry out in order to confirm the diagnosis for Mr. Lim. Now, when I said about intracranial hemorrhage, if you look at what Mr. Lim is having, severe headache associated with blood vision, neck stiffness, as well as papilledema. So there's a possibility that this patient is having intracranial hemorrhage with possibly brain edema due to the presence of papilledema. And when you're going to do a full neurological examination, there is a likelihood that you will discover a neurological deficit. So it is very important for you to do a full neurological examination for Mr. Lim. And further investigation, such as any imaging, is needed in this patient for you to be able to identify his diagnosis as well as to plan for further management. Alright, let's move on to case 2. How about Mrs. Miller? What are the information that you think you will need from Mrs. Miller in order for you to identify her problem? You will need to ask about her menstrual cycle, whether it's regular or not, because nausea and vomiting can simply be a sign of early pregnancy. You want to know whether she is sexually active. Is she planning to get pregnant? What are her previous medications? And if she has any other medical history, maybe such as migraine. And of course, you want to do a examination and also investigation for you to rule out the diagnosis. So most likely Mrs. Miller has a migraine. So for this purpose, she may need a preventative medication or maybe a simple painkiller. So you need to ask regarding the presence of aura, the severity of the migraine or the headache, and also the frequency in order to identify the main problem and before deciding on a therapeutic objective. So before you proceed to the other steps, it's important for you to define the patient's problem, where they can come to you with the disease itself or signs of the underlying disease. It could be a psychological or social problems. It could be a simple refill request, but please be reminded that it could be a polypharmacy. It could be a symptoms that is related to non-adherence to treatment. It could be a side effects of medications that the patients are taking. And it could be a request for prophylaxis or preventative treatment. And last but not least, it could be a combination for everything.